Good.
Okay, can you hear me okay? Yeah. Good afternoon. As you can see, we'll be talking about the healing power of herbs. And as you heard, I'm a naturopath, as a ministry and practice based in Orlando, Florida, but I live just up in Eustis. There is the natural medicine and whatnot is exploding, but it's been going against a lot of a kickback from the other side. So, but natural medicine can be very, very effective. But we have to understand how it works and how to use it. Now I see, we didn't mention it, but we started, I guess it's a school, I call it a school, but in Florida you can start a non-profit or religious school under the Department of Education. And you can, that's what we did in Orlando, and I have a couple of students here. And basically they went through, have you guys went through every class? 3 classes? And it was basically Medical Missionary 101 with the beginner, Medical Missionary intermediate level, and then we did another class that we dealt with, what was it? Body mechanics with Dr. What's his name? You forget? You weren't in that class? And then we did advanced medical missionary, where we actually went to some of the higher levels. So again, today we're going to be talking about a little bit about how to use herbs and how they benefit the body. Now the hardest part of doing this was herbs are a broad spectrum. As a naturopath, we're basically trained in, one of the areas that we're trained is in herbology, but we also train in a lot of other areas. And so, herbology is one of the areas that we're trained in, and it's a very broad area. So one of the most difficult things to do was to determine what part of herbs, which one should I talk about, and the amount of time that I have. We get to pick one herb and talk 2 hours on it. So that was the most difficult thing to do. And so we're going to cover a few herbs and how we use them. So before we get started, if you don't mind, I'm going to get a quick word of prayer, okay? Heavenly Father, we thank you so much for the privilege of coming into your presence. We ask for your presence in a special way. We ask that you would forgive us for our sins. And we thank you for your tender mercies and your loving kindness toward us. In Jesus' name we pray. Amen. Now, natural medicine includes physical, mental, spiritual, and emotional. So this is one of the reasons why I pray. Even when I'm working with people, I often ask them, can we pray together? So mention any natural medicine that you deal with, you're going to have a spiritual element to it. But not everybody comes from a Christian angle. Some people come from a Far Eastern angle. But I come from the Christian angle when dealing with natural medicine. The healing power of herbs. Before I start, I want to give a quick, about a 45-second health nugget. Is that okay? I was talking to my mother a couple of weeks ago. She said, I'm having like a fever blister come. Can you tell me something for this fever blister? And normally I started thinking, there's an amino acid that you could take called L-lysine, but that takes a while and so I said, I can tell you something. I said, you may think it'll be a little gross, but it works like gangbusters. She said, okay, what is it? I said, take a Q-tip and take a little of the wax out of your own ear and put it on there. It works. So here's what I found. The power in being able to heal lies in its simplicity. Now, sometimes you get very difficult cases that it takes a little more that goes into them, but still, even the difficult and complex cases, you have to always remember to keep it simple. To keep it simple. Now, I also want to say this. I'm going to have like the last maybe 15 minutes a question and answer session. So I would appreciate like if you hold all your questions. And when I'm talking, some people might say, I want to add. Don't add. Just listen. The reason being, not that I'm trying to be mean, but what happens, a lot of interruptions, it throws everything off. And so you may know something that I didn't mention, but if you want to mention it, just wait till the question and answer session, okay? Now, our chief medical book. This is my chief medical book. This may seem strange when I say this is the chief medical book, but this is the chief medical book, okay? You'd be surprised how scientific that this is when it comes to healing. Now, why do I say that when it comes to herbs? It says that in Psalm 104:14, he, speaking about God, causeth the grass to grow for the cattle and herb for the service of man. So the herbs are put here for our service, to benefit us. Now, let me give an example. It says, a merry heart doeth good like a medicine, but a broken spirit drieth the bones, right? This is an example why it's a medical book. A merry heart doeth good like a medicine, but a broken spirit drieth the bones. Now, what happens in your bones? Your bone marrow, your red blood cells are produced there. Your white blood cells are produced there, right? Now, here we see, when I said the Bible is a medical book, here it's telling us the connection between the mind and the body, for example. It's telling us that your emotions can affect you physically. Did you know this is true? This is a scientific fact. But this was already written a long time ago. So, a merry heart, if I have positive thoughts, if I praise God. Did you know when we praise God, it actually increases your immune system? So, if I have a merry heart, it says it doeth good like a medicine. It benefits the physical, the mental, the spiritual, the emotional, everything. But a broken spirit drieth the bones. So if you're depressed, sad, downtrodden, it actually affects your red blood cell production. It affects your white blood cell production. So your emotions can actually affect you physically to where it can make you sick. That was already taught. That's why I say the Bible is a great medical book. And then it says again, a sound heart is the life of the flesh, but envy an emotion, a negative emotion, right? So envy is a rottenness to the bones. Imagine that you have cancer of the bone marrow. Think about that for a minute. Think about having the negative effects the negative things that can occur just from one negative emotion, envy. And I have a presentation that we actually go through and we talk about how anger, what specific organs anger can affect, what specific organs sadness can affect. Sadness affects the circulation of the blood. So when I say that the Bible is a great medical book, the great principles in it, it is. So now, the healing power of herbs. The healing power of herbs. Now, like I said before, when you're looking at herbs, herbs are just over 300,000 different herbs. And so the hard part was to say, okay, what should we talk about? How can I just kind of zero in and narrow this down some? Now, first, we're not going to go through all of the classes, but just as a backdrop, there are actually different classes of herbs. And so, like for instance, alterative or certain herbs that gradually restore the proper function of your body by modifying nutrition so as to help your body reach a state of homeostasis or balance and increase health and vitality. So think about it. This is one class of herbs that does this. There are other herbs called nervines. There are all kinds of different classes of herbs. So we're not going to try and go through all the different classes. But basically, this just gives an example that there are different classes of herbs. Now, we'll look at some examples of these alteratives. Examples are the herbs stinging nettle, burdock, yellow dock, blue flag, dandelion root, and red clover. Those are some of the herbs that fall under the alterative section, where you take them over long term and actually can modify the body to help bring the body into homeostasis or balance. There are a lot more, but it's just an example. Now, I want to start off with charcoal. Now, many of you are probably familiar with charcoal, but there's a lot of different ways to use it. And a lot of times when people use certain herbs and whatnot, they say, well, this didn't work. Or it didn't work. Many times it's not that their herb didn't work, it's that you might not have used it correctly or used it in the right amounts. Now, why do I call charcoal a herb? Because really you get it mainly from a tree. It's also taken from coconut hulls, but mainly you take it from wood. And so basically charcoal is, if you have like a medical kit, an emergency medical kit, you want to have charcoal in that kit. You know you need to have charcoal in that kit. You should have charcoal in your home, activated charcoal. Now we're not talking about the charcoal where where people do the you grill and you cook. That's not the charcoal I'm talking about. I'm talking about activated charcoal. Now, I've used it, have occasion to use it many times. And I can remember my wife one time had I don't know what happened, her finger. One day it was like swollen and it was very, very tender to the touch. I think she woke up. Did you wake up with it like that? Think something bit you or something? Her finger swole and it was very, very tender to the touch. And it was throbbing. So we simply took a little charcoal. We mixed a little bit of slippery elm. Did we mix slippery elm with it? And we mixed the slippery elm. We'll talk about slippery elm here today. We mixed just a little bit of slippery elm with it, with a little water. Now both of these will draw the inflammation out of the wound. That's the concept, to draw the inflammation out. So we put it on. Now during the night, of course, the pain got a little more intense. Why? Because the charcoal was drawing out the inflammation. So as it drew out, the pain got a little bit more intense, but the next day it was almost like it never even happened. And so this is why I said you need to have charcoal for snake bites, ant bites, any type of insect bite. Now, especially in Florida, we have brown recluse spiders. And if you're bitten by a brown recluse spider, the only thing that they can do at the hospital for you is give you prednisone and surgical incision. And this is why if you're bitten, it's going to just, the poison will eat all the way down to the bone. But charcoal will render the bite harmless. So let's look at, this is from, I'll give you this book in a minute. This is a book that I highly recommend that you get and have in your library. And he says, he gives a couple of occasions where he's had an opportunity to use charcoal in helping people. I just want to give you a couple of these. He says, a prominent Columbus, Georgia executive was traveling to Mexico when he developed a bad case of turista, the common euphemism for diarrhea amongst tourists. It is generally caused from E. coli bacterium in unsanitary food and water. He was having diarrhea 2 to 3 times an hour on the first day of his disease, which with much discomfort in the abdomen. A doctor treated him with the usual antibiotics and Lomotil. So he has a bad case of diarrhea. A week later, when he returned home, he consulted with his own doctor because the condition had settled down to 3 to 5 diarrhea stools a day with continuing discomfort. He got a change of medication, but no change of symptoms. Then what happened? After 12 days of the disease and 8 different medicines, he called us, desperately seeking suggestions for a natural remedy. That's something that we find in those in the natural health field. You find it quite often. Now, there's a place for what we call allopathic medicine, regular medicine. There's a place for that. But that really should be the alternative. What we've done is we've flipped it around. We have what should be the primary, we have it as the alternative now. And so normally what people do, they make it a lot more difficult for a natural practitioner, because by going first to the regular way, and they give the opportunity for the disease to progress or the abnormality to progress, and then sometimes they load their body down with other medications. So now the natural practitioner has to deal with the progress disease and also the toxicity of the medications. So it makes it that much more difficult than if they had gone the natural way first, and then, if necessary, go to the allopathic way. So he says, we begin a routine of 1 tablespoon of charcoal in a glass of water, followed by a full glass of water every time you had a loose stool. So remember, sometimes it depends on how you use the remedy. So notice what he did. He says, we begin a routine of 1 tablespoon of charcoal in a glass of water, followed by a full glass of water every time he had a loose stool. Within 2 days, he was entirely well and sold on charcoal. Now, he never travels without charcoal and always takes a tablespoon with the first hint of a symptom. You can get that book at, I highly suggest that you get it and have it for your library. It gives you a lot of different ways and under circumstances to use charcoal. It's called charcoalremedies.com, the complete handbook of medicinal charcoal and its applications by John Densley. Again, he says, he talks about cellulitis, where he's used it in cellulitis. He says, we have seen pain and severe throbbing and feverish cellulitis subside in a matter of 5 minutes after the application of a charcoal poultice. I've seen it also for use when you're combining it again with slippery elm for a toothache. Throbbing toothache, I've seen it help by doing the same thing, by making a paste and placing it over the tooth. You'll feel that throbbing. It'll get more intense at first, and then the pain will go away. Now, if you have an abscess or something, you have to deal with the underlying cause. But for that pain, it's going to help a lot. He says, we have seen pain and severe throbbing and feverish cellulitis subside in a matter of 5 minutes after the application of a charcoal poultice. He said, the reaction is unbelievable unless actually observed. Now, what's cellulitis? According to Mayo Clinic, cellulitis is a common, potentially serious bacterial skin infection. The affected skin appears swollen and red and is typically painful and warm to the touch. Cellulitis usually affects the skin on the lower legs, but it can occur in the face, arms, and other areas. It occurs when a crack or break in your skin allows bacteria to enter. They also say, left untreated, the infection can spread to your lymph nodes and bloodstream and rapidly become life-threatening. So here you have a simple herb that is taken or used not long after you have the issues that can actually stop something that could be life-threatening and that could end up killing you. I saw something on Fox News .com the other day. They published a article where a lady came across some type of a fungus. It got into her bloodstream. And when it went through her bloodstream, before they could stop it, they ended up having to take out both of her eyes, a piece of her brain, her palate, and she had just gotten married a few weeks back. And now she's pretty much incapacitated just from a fungal infection. So sometimes we can't take these things lightly. Bacteria, fungi, they can be very problematic. And so, but the Creator has given us an immune system. And when the Creator put that immune system in us, that immune system, when working ideally, you can't get sick. Did you know a lot of cancer researchers, especially on the natural side, they say that the average person has 7 serious bouts with cancer in their lifetime they never know about because the immune system shuts it down. So the Creator has put in us a system to keep us well. But we have to, that's why in the natural medicine side, we believe in working with the body, working with the immune system, so that instead of fighting against it.
Sir, may we ask a question?
Yeah. I'm going to give you the last 15 minutes. So just write it down. Also in the book, he talks about charcoal remedies. In this book, Charcoal Remedies, he says snake bite. He says, our first case was reported to us by telephone. A couple living in a remote area of Arkansas, 60 miles down a winding road from the nearest hospital, called in great distress to report that their 1.5-year-old son had been bitten on the chest by a copperhead moccasin. This snake may cause death in a small child. The fang marks were surrounded by some swelling, and the child was in great pain. He says, we instructed the couple to get to the emergency room as quickly as possible. We also told them to apply charcoal poultices, one after the other, every 10 minutes until they got there. This is the same thing you should do if you're bitten by a brown recluse spider. Same thing, apply that poultice every 10 minutes. Also drink, put a tablespoon of charcoal in that water, 8-ounce glass of water, and drink it. But be sure to place that poultice on there. This works because I told you before, if you're bitten by a brown recluse, you know, there's not much they can do when you get there, but basically, as that venom is eating through your skin and tissue, it's going to eat all the way to the bone. So in order to stop it, if you get that poultice on there, that's why I said you need to keep activated charcoal in your home, in your car. Keep it, make a little natural emergency medicine pack where you have this in there and some other things like cayenne. I'm not going to cover cayenne in here, but you need to have cayenne in there as well. And it needs to be at least 90,000 heat units hot because it'll stop a heart attack if it's that hot. But you need to have cayenne there in your pack as well. He says, we were greatly relieved when they called several hours later to report that the child was doing quite well. In fact, by the time they had gotten to the hospital, he says, the child was asleep. The swelling had gone down and the pain had obviously stopped. The physician administered the antivenom to be on the safe side, but told them that he didn't really believe it was necessary. The child had no ill effects. Just from a simple charcoal. Now, this is a quote. It says, one of the most beneficial remedies is pulverized charcoal in a bag and used in fermentations. This is a most successful remedy. Now, if wet in smartweed is a different herb. Boil, it is still better. I have ordered this in cases where the sick were suffering great pain, and when it had been confided to me by the physician that he thought it was the last before the close of life. Then I suggested the charcoal, and the patient had slept. The turning point came, and recovery was the result. The place of herbs and rational therapy. That's from Ellen White, an Ellen White quote. In fact, she also said if she was somewhere where she could only have one remedy, it would be charcoal. That's how effective and important it is. Now, let's move on to the next one. The next one is hawthorn berry. Anyone ever heard of hawthorn berry? In natural medicine, it's a herb used a lot for the heart and circulatory systems. Hawthorn contains compounds that support the heart and the circulatory system. It is used regularly to protect against the beginning stages of heart disease. It is also excellent to help speed recovery from a heart attack. It contains several nutrients. Now, this is one of the things about herbs. I talked about how in taking herbs, you want to be able to take them to help support the body and also to help the body recover from sickness. And one of the ways herbs do this is because they have certain nutrients in them. Take, for instance, hawthorn berry. Hawthorn berry has vitamin A, it has vitamin C, it has sodium, it has selenium, potassium, chromium, niacin, and about 19 other nutrients. So the Creator has built the perfect vitamin in these herbs. Now, the herb with the most nutrients is probably the herb alfalfa. It has the most. It's called the king of herbs. But hawthorn berry, if you have heart issues, now, if I was making a formula for this, I would add cayenne pepper also into with the hawthorn berry. I would combine cayenne pepper. Why? Because when you combine the two together, the cayenne pepper is going to dilate the blood vessels, and it's going to deliver the hawthorn berry quickly throughout the system, or quicker. And it's going to help it get to where it needs to go, to your heart, etc. But talking about hawthorn berry, it is excellent for cases of congestive heart failure, etc. Now, this is from Michigan Medicine, the University of Michigan. So again, and as I was talking to Brother Blue back there, I said sometimes when people talk about natural medicine, they have these images and talk about herbs. They don't think that it's scientific. And people have these images when you talk about herbs, they say, oh no, this guy's somewhere in the back room mixing potions. And that's not, you know, true herbology. It's not how it works. They're very scientific. So this is from University of Michigan. They're talking about hawthorn berry. And they say, the antioxidant hawthorn appears to reduce symptoms and improve exercise capacity by increasing blood flow to the heart and the strength of heart contraction and reducing resistance to blood flow in the extremities. Clinical trials have shown that standardized extracts from the leaves and flowers of hawthorn are effective in helping people with early-stage congestive heart failure. A herb helping with congestive heart failure, huh? Interesting. This is from now. It's interesting when you study some of the universities. Sometimes you can tell the way they write, some of the things that they write, that they really don't want to admit it, but they're having to admit it. They have to. They go on to say hawthorn extracts appear to increase blood flow to the heart. I want to jump down. It says, in a large preliminary trial, people with mild to moderate congestive heart failure were given 300 milligrams of hawthorn flower and leaf extract 3 times a day for 2 months. The symptoms of congestive heart failure, including heart palpitations, chest pressure, and swelling in the extremities, decreased throughout the trial during the use of hawthorn. The efficacy of hawthorn for the treatment of congestive heart failure has been confirmed in a double-blind trial. Now, hawthorn is one of those herbs that is probably better to use if it's standardized. A lot of times it's best to use herbs without the standardization. And let me explain what I mean when I say that. When they standardize a herb, they would take what they've found to be the active ingredient, and they would basically say, okay, the active ingredient is this. So we're going to make sure that in every capsule it's going to be 300 milligrams of this active ingredient in every one. When you take a non-standardized herb, say for instance if you go in your kitchen and you mix some herbs together and you put it in capsules, those are non-standardized herbs. So you may get in one capsule, you know, in that batch you may get 500 milligrams per capsule, and the next you may get 300 milligrams. But the benefit of the loose herbs is that they're not standardized. So there are other constituents in there that can help you, that the creator put in the herb anyway, that works synergistically with the herb to make it, to enhance the way that it works in the body. So when you use standardized, sometimes it has its own benefits, but I kind of like using also just non-standardized herbs because they also have their benefits. But hawthorn tends to be one of those that it works better when it's standardized. Now, if you take, for hawthorn, you take 4 to 6 grams of the herb every day, and we would tend to get the same benefit for your heart. So if you have, or if you know someone that have heart problems, congestive heart failure, high blood pressure, some of these other issues, hawthorn is one of the things that's going to help their heart. Now, you don't just take a herb and say, I can just eat what I want and drink what I want and don't exercise. It does not work like that. Okay? So listen, there is no magic herb. You have to, the herbs are they're supplements. What are supplements? They supplement your healthy lifestyle. So again, also it's shown to help angina or chest pain with people with heart issues because it's going to benefit the heart overall. So again, if you have heart issues, I come across a lot of people who have high blood pressure, congestive heart failure, you know, and what happens if you don't correct these issues, sooner or later, you're going to have to pay with sickness or pay with death. So it's good to get on these issues and find out what's going on, and then be on a program or some type of protocol to help with these issues. Now, this was from Preventative Cardiology. They found that a German study showed that a hawthorn extract worked nearly as well as the prescription heart failure drug, and the hawthorn extract had fewer side effects. Now, have we seen the opioid issue that we're having here? Yes. A lot of people, I think I read the other day that like 3,000 people a day or a week are dying from just opioids, right? And like I said earlier, allopathic medicine has its place, but we need to try and first go use these natural compounds in an intelligent way. You know, you can use them, but they need to be used in an intelligent way. And like sometimes you need to use enough of what you're doing, and sometimes you have to do it longer, depending on what you're doing, because these herbs are working on the cellular level. Remember, we live or die on the cellular level. What do I mean by that? What happens at the cellular level? The cells make up the tissues, right? The tissues make up the organs. The organs make up the systems, and the body is made up of these systems. So whatever happens on the cellular level is going to determine whether we live or die. These herbs, these natural remedies, they tend to work on the cellular level. That's why they may take a little bit longer. Drugs come in, on the other hand, and they work on the cellular level too, but they really don't deal with the cause. They're just there to take away the symptoms. This is why some people they may be on blood pressure medication for 20 years. I'm saying, well, if it worked, if it really healed you, why didn't you just stay on it for 20 years? Right? Because it's only working on the symptoms. Oh, I get it. Yeah. Our next herb is going to be willow bark. Anybody ever heard of willow bark? Willow bark is considered in herbology pretty much as nature's aspirin. In fact, if you go back and do a little history, you'll find that aspirin, basically the chemical structure, the molecular structure of aspirin is actually based on willow bark. So basically what Bayer did back in the day was they took and they copied the molecular structure of aspirin, made a synthetic form of it, or a molecular structure rather of willow bark, made a synthetic form of it, and they give it to us as aspirin. Willow bark, and willow bark is essentially nature's aspirin. Aspirin is the most used medication in the world, and is actually a close relative of white willow bark. The Indians of North America use white willow bark to relieve headache, fever, and to ease aches and pains in muscles, as well as for rheumatism. So normally in natural medicine, they would tell you when you're studying that normally if the Indians, the American Indians, use the herb, you want to use that herb. Because they were experts along those lines in using those herbs. And the one of the herbs that they used a lot was white willow bark. Again, I call it nature's aspirin. Hippocrates, who knows Hippocrates? Who knows who he was? You know, the doctors take the Hippocratic oath, right? And the first step of that, it says, do no harm, right? Did you know, it's funny how allopathic physicians take that oath, but you know, he was not an allopathic doctor. Did you know he would be what we call a naturopathic doctor? That's what he was. Did you know that? Did you know that he was what we would call a naturopathic doctor? But it's funny that allopathic doctors take that oath, or they took, from what I understand, they're getting away from it, taking that oath. But it's kind of funny how that worked out. Hippocrates even used white willow bark to relieve pain and fever. Then they have, again, all of these herbs do have a nutritional profile. The nutritional profile of white willow bark, you can see it there. It has calcium, very, very, very high in calcium. It has magnesium, has niacin, phosphorus, potassium, selenium, sodium, vitamin A, vitamin C. And this is it's calculated on the zero moisture basis for every 100 grams. This is how it's calculated for the amount of nutrients that they have in there. So again, every herb that you could take, that's why I was telling you, when we talk about taking herbs, it's not like, you know, it's just someone mixing potions. Each of these herbs have a nutritional profile to them, and the body needs these nutrients to function. And normally when you get sick is when normally you fall into some type of deficiency somewhere. And if that deficiency goes along, you know, the body can compensate for a while, but if that deficiency goes on and on and on and on and on, is when you get sick. So again, the Creator has made this body, it's in our health, outside of our salvation is our greatest blessing. Because when you're not feeling well, it's even hard to worship God. Willow bark is a proven painkiller, but without the side effects of aspirin. Willow bark's actions are typically slower acting than that of aspirin, but last longer. So this is the thing. When you take aspirin, you're probably going to feel the results a lot quicker, but the results are also going to go away a lot quicker. White willow bark is going to take a little longer, but the results are going to be longer lasting. Why? Because it's not just working on the symptoms, it's working on the underlying cause, which is the inflammation normally when you're having that pain. People have used white willow bark, naturopaths and other herbal practitioners, whether it be even medical doctors who now practice natural medicine. Some of those, you have some medical doctors that now practice natural medicine, some DOs, you have herbalists. So you do have other people outside of naturopaths and herbalists that integrate these things into their practice. These are some of the other things that you see that it's been used for: fever, minor infections, acute and chronic rheumatoid disorders, headaches, and pain caused by inflammation. Now, these things are going to work better when you combine them with, like for instance, white willow bark is an anti-inflammatory, but when you combine it with another anti-inflammatory, like we're going to talk about, frankincense, right, is in here, you'll find that in fact, frankincense is probably more powerful than willow bark for pain and inflammation. But when you combine them together, you take it to a whole nother level. I can remember, I'm going to use my wife again as an example. One time she had a really, really bad toothache. I think it was an infection, and she couldn't get to the doctor for like probably 2 weeks. The dentist, they couldn't get her in for 2 weeks. But, you know, the pain was going up and up and up and up. So I said, okay, you know, we got to figure out something here. And basically, to make a long story short, I combined white willow bark with another pain reliever. We're not going to cover this today, but just as an example, a pain reliever called Jamaican dogwood. Anyone ever heard of Jamaican dogwood? Yeah. So now, when you take it, on the bottle, it says Jamaican dogwood. Oh, only take 40 drops, right? For that type of pain, 40 drops is not going to be enough. You know toothache pain. You ever had toothache pain? So I had to take 2 entire dropperfuls. 2 dropperfuls. Knock the pain out. Like 16 hours probably, knock the pain out. So remember, sometimes it's knowing the amount to take. Now, if you combine, say, white willow bark with Jamaican dogwood and boswellia or frankincense, if you combine those 3 painkillers together, you're going to have some power there to deal with most kinds of pain, even pain that opioids sometimes can't deal with. But that's what our Creator has given us, these things, and you don't have to worry about the side effects. I mean, don't get me wrong, some herbs do have side effects, especially when you get into extracts, which are stronger. Now, what happens, you can use these herbs in certain ways. You can use them as capsules or powder, or you can use them in teas, which is called a decoction in herbal medicine. Or you can use them a little bit stronger. You can use them in extracts and then tinctures. And then the most concentrated form is when you use them in oils. And so as you get higher up, they become stronger and stronger. But sometimes just taking them in capsules, powder, or taking them in tea, and it depends on how much you take, or you can take the extracts. When I gave her the Jamaican dogwood, it was actually the extract. And again, it's beyond the scope of this presentation to go into how you make them, but suffice it to say, the strongest and the most concentrated you're going to take is in the oil, and then in the tincture or the extract, and then in the tea, they call it. And if you read herbology, they'll use these terms like decoction, which like, what's decoction? It's just a tea. Okay, so, and this is just talking a little bit about some of the, this is from Penn State Hershey, Milton S. Hershey Medical Center. They were talking about white willow bark. And they're saying the bark of white willow contains psilocin, which is a chemical similar to aspirin, in combination with the herb's powerful anti-inflammatory plant compounds called flavonoids. Psilocin is thought to be responsible for the pain-relieving and anti-inflammatory effect of the herb. And that's from Penn State Hershey Medical. center. In fact, in the 1800s, salicin was used to develop aspirin. White willow appears to bring pain relief more slowly than aspirin, but its effects may last longer, they say. Then they point out this study. They point out in a well-designed study of nearly 200 people with low back pain, those who received willow bark experienced a significant improvement in pain compared to those who received a placebo. People who received higher doses of willow bark had more significant pain relief than those who received low doses. So in other words, by taking a little bit more, they had, of course, better results. They go on to say, several studies show that willow is more effective at reducing pain from osteoarthritis than the placebo. In a small study of people with osteoarthritis of the neck or lower back, those who received willow bark experienced significant improvement in symptoms compared to those who received a placebo. Again, that is research from Penn State Hershey, Milton S. Hershey Medical Center. A similar study of 78 people hospitalized with osteoarthritis of the knee or hip joint found that people who received white willow bark had significant pain relief compared to those who received a placebo. Our next herb is slippery elm bark. Anyone ever hear of slippery elm? Now, I've had cases with Crohn's disease where I've used this for Crohn's disease. Crohn's disease it can be a problem. And the drugs that they recommend for it can be even a bigger problem. In fact, is it Humira? Humira is one of the drugs that's recommended for Crohn's disease, but one of the side effects of Humira is Crohn's disease. So, you know, it's interesting. Slippery elm is, anytime you're having any gastrointestinal issues, slippery elm is your friend. Slippery elm is your friend. Slippery elm has a soothing as well as a healing effect on nearly any area of the body that it comes into contact with. It is used in the treatment of sore throats, indigestion, digestive irritation, and stomach ulcers. It can be used externally as well for wounds and burns. It can help relieve irritated as well as inflamed itchy skin. Remember I said that I combined slippery elm with the charcoal. And again, if you combine the two together and have a wound, it's going to have a similar effect to the charcoal. It's going to draw out the inflammation. But it can also be taken internally. Now, if you put it in a cup and you mix it, you kind of have to, if you put like maybe a tablespoon of it, of the bark, if you leave it, it's going to get really, really thick and turn into like a gruel. But a lot of times you also find slippery elm in colon cleansers. And the reason they put it in there is because of its capacity and ability to draw the toxins out of your gastrointestinal tract. Now remember, did you know you have two brains? Did you know that? You have two brains. Did you know that? You have a brain up here, and you have what scientists call the second brain down here in your gastrointestinal tract. Did you know that? In fact, if you look at the science, and I give you, whenever you get a chance, go online and just look up the second brain, and you will see that you have just as many neurons, if not more neurons, in your gastrointestinal tract as you do in your brain. And the two communicate. That's why many people, that's why what you put in here can affect this. They call it the second brain. And so a lot of times with people who are suffering from depression, I know that if I can't help them here, we're not going to be able to get that depression dealt with. That's why when they in depression drugs, they have what they call serotonin uptake inhibitors. That's to suppress the serotonin and you know where most of your serotonin is? Here. And so the reason they have it is they treat the second brain to affect the first one. So remember, you have two brains. So remember, even if you read from the writings of books like Counsels on Diet and Foods and Ministry of Healing, you'll read about the connection between the gut and the brain. The reason being, scientifically, you have more neurons in here than you have here. And they communicate with one another. So, slippery elm helps your second brain. And by helping your second brain, you're going to help your brain up top. Slippery elm is indicated in diseases such as Crohn's disease, food poisoning, and irritable bowel syndrome. Did you know if you look at the commercials for the drugs for IBS, most of them have as one of their side effects or potential side effects is death. Did you ever catch that? If you listen to the commercials for IBS, the drug that they recommend, that doesn't mean that if you take the drug you're going to fall out and die, but you might. So just understand that, listen carefully to the side effects. And if you say, okay, I think the risk outweighs the reward, then, but they do say it really fast, they do. You know, they go really fast. But just remember that all drugs have negative side effects, all of them. And so, again, that's not to say now that sometimes there's not situations. If you're in an accident, right, and you need to be stabilized, then you're going to need the drugs to stabilize you. Or if you have blood pressure that is not coming down, and what I found is that when a person has blood pressure that's not coming down, no matter what you do for the natural things, normally you got to look at their hormones and their stress. Because normally when you do the physical things, you know, the walking, the herbs for it, make sure you're drinking enough water. If you're dehydrated, your blood pressure is not going to come down. Why? Because the blood is about 80% water. So if you're dehydrated, the blood is going to be thicker as it goes through the vein and as it goes through your arteries. And as it goes through your arteries, it's going to put more pressure on your arteries, and so your blood pressure is going to come up. So sometimes you can reverse high blood pressure just by reversing dehydration. So again, you have to look at every area that you're dealing with, and if you do everything and the person's blood pressure still is not coming down, you have to look at the hormones and you have to look at their stress, which a lot of times go hand in hand. Because if you're a worrywart or a stressor a lot, your pressure is not coming down. Because when you stress, guess what happens? Your arteries narrow. Your arteries narrow, and stress is your #1 killer. This is why, you know, you've probably heard presentations on the laws of health, right? Trust in the Creator, sunshine, exercise, water, air, rest, diet, self-control, or temperance. One of the ones to help with stress, or to help deal with that stress, is trust in the Creator. Why worry about what you can't control? Right? If you can't control it, why worry about it? So that's trust in the Creator. It has been used for irritation caused by colitis, chronic diarrhea, esophagitis, gastritis, and duodenal and peptic ulcers. You notice how everything at the end has that itis at the end? That means inflammation. So it helps inflammation. It goes on to say, science believes that taking slippery elm by mouth induces a reflex reaction that causes the stomach to secrete more mucus. The mechanism of action in the upper stomach and esophagus appears to be reflux stimulation of the nerve endings in the lining, which causes increased mucus secretion. This seems to increase the protective coating, shielding the stomach and small intestines from excess acidity. In one study, slippery elm was found to elicit a similar response in patients with the inflammatory bowel disease, ulcerative colitis, when compared with 5-aminosalicylic. Thank you. And that's basically a drug. It's a class of drugs for Crohn's, is basically what it is. Researchers examined the anti-inflammatory effect of slippery elm on colonic cells biopsied from 45 patients with active ulcerative colitis. Findings revealed a nearly equal dose-dependent response in both. So basically what they were saying is that the slippery elm performed on the same level as the Crohn's drug. Interesting, huh? Like I said, I've seen it, I've used it, and recommended it in cases of Crohn's, and I've seen, not just it alone, there was a whole protocol, but it was one of the main constituents in the protocol for the Crohn's. Comfrey, one of my favorite. Anyone familiar with comfrey? The Indians call comfrey knit bone. Remember I told you if an Indian used the herb, it's a good herb. They called it knit bone. Why do they call it knit bone? Because comfrey can actually regrow bones, flesh, and tendons. Now, let's stop and think for a minute. That blows your mind, right? That an herb can actually regrow flesh. Let's sink in just for a minute. I even used it on well, he died last year, but I had a German Shepherd. When he was a puppy, another dog got loose from someone else and attacked him. And we didn't realize all of the scars until I noticed he kept licking right here in this area here. He kept licking. Come to find out, there was a deep, basically a gash, a hole where he had been bitten. So, of course, I made a comfrey combination. I used the herb comfrey, powdered comfrey. I used a little bit of honey. That's to help with the infection, to keep infection down. And wheat germ oil, which, well, the wheat germ oil on a human would be used to help prevent scarring or either vitamin E. But I made the combination, and you make it, and you basically pack it into the wound. Just pack it into the wound. Now, at first we had a little problem because he smelled the honey, so he wanted to eat it. So he kept eating it out. So we had to put, one of the things around his head and pack it in the wound. And within less than a week, the hole was gone. And as the body sinks in, because comfrey is scientifically, it's a cell proliferant. It causes the cells to grow. So within less than a week, the hole was filled. And basically, when it was sinking, you just put more. Just put more. It'll sink, and the body takes it in, and it causes those cells. Remember I said, we live or die on the cellular level. So if it causes the cells to grow, right, it's going to regrow the tissue, which is going to regrow the organ, right? So again, when I tell you these things, I'm not just making this up. It's not just something I read somewhere. These things I've actually used in my practice or used myself personally, and I've seen them work in the real world. So again, comfrey is used to heal broken bones and to heal wounds, i.e. regrow fresh. There's another herb that I came across recently that's supposed to be similar to this. It's called Solomon's herb. That's supposed to have some similar, I got to look into a little bit more, but I understand it has similar properties. But comfrey, Indians call it knit bone. Now, Dr. Shook, he was one of the greatest herbalists. He was a great herbalist. He was, anybody ever heard of Dr. Christopher? Herbalist Dr. Christopher? Dr. Shook was one of Dr. Christopher's teachers. And Dr. Shook commented on the efficacy of comfrey. He said, it does not seem to matter much which part of the body is broken, either internally or externally. Comfrey will heal it quickly. It is a great cell proliferant or a new cell grower. It grows new flesh and bone alike, stops hemorrhage, and is wonderful for cough, soothing, and healing the inflamed tissues in a most remarkable manner. So again, you have these guys who are these master herbalists who actually, they didn't depend on drugs. They had to come up with a way for these things to work. What combination should I use? How should I combine it? With what herb should I use it? And they had to come up, and they come up with these, Dr. Christopher, Dr. Shook, and they had some amazing, when I was in school, one of the books that we studied was from Dr. Shook, his master herbology book. And so these guys were masters at this stuff. And Dr. Christopher, this is what Dr. Christopher tells this story here. He says the son of a registered nurse in Provo, Utah broke his arm, so she rushed him to the hospital. When the doctor x-rayed the arm, he told them the bone was clean broken, so clean that he would have to use a brace for a few days until the knitting started before applying a cast. He told them to return in 5 days. The arm was bare, so on arriving home, his mother put comfrey poultices and fomentations around the arm and gave him comfrey tea, comfrey green drink, comfrey tablets, and capsules. Now, if you read online, they would tell you do not take comfrey internally, right? But when you read the studies where they gave the comfrey, they gave it in such high amounts that no human would be able to take comfrey on that level. So 5 days later, when she took him back to the doctor to get the cast, the doctor took another x-ray. He said, "What have you done to this boy?" He proceeded to announce the bone was knit together without even a hairline crack. Dr. Christopher also tells a story of two young boys that were brought to him. One young boy that was brought to him, I'm sorry. He says, these two boys were playing with matches. And somehow they got into some gasoline and there was an explosion. And it basically burned their hands down to the bone. One parent took the child to the hospital, and they went, through, what they do, skin grafts and whatnot, or whatever they had to do. The other child, the other parents decided to bring their children to Dr. Christopher. He uses bone, flesh, and cartilage, which is basically the main ingredient is comfrey. And in a few weeks, he tells how it grew back all of the flesh, tendons, everything. The other young man went to the hospital. He basically ended up having to have all he had was claws left, and they had to put he never was able. His fingers, his hands. He didn't have use of his hands anymore. So again, remember, I know this might seem like this seems like a fairy tale. This can't be true. But when these herbs and things, remember, they are infused with healing from the Creator. That's why it's possible. The price? Oh, yeah. The young man who had all of the surgeries spent thousands of dollars. This with comfrey, probably less than 20 or 30 bucks for that whole treatment. Elderberry. Now, we're in flu season, right? Who's familiar with elderberry? It's one of the more popular herbs, and it's used. It's used for a lot of areas. It's most popular for the flu and for colds, viruses, and so it's another thing in the flu season. It's good to have on hand. Good to have on hand. Elderberry or elder has been used for centuries to treat wounds when applied to the skin. It is also taken by mouths to treat respiratory illnesses such as cold and flu. Again, Penn State Hershey, Milton S. Hershey Medical Center, they looked at it. They say a preliminary study found that a lozenge with elderberry extract, helped reduce flu symptoms when taken within 24 hours of symptoms starting. In the lab, one study suggested that elderberry could kill the H1N1 virus, swine flu, in test tubes, but researchers do not know whether it would be effective against H1N1 in people. So in test tubes, elderberry was able to kill the virus causing the swine flu, right? Now I have a question for you. Why, if antibiotics do not work for viruses? You know they don't work for viruses, right? Why do we take them sometimes for viruses? Yeah, I'm just being facetious. Again, the great herbalist Henry Box of Plymouth, England. This is Dr. Christopher citing him. The greatest herbalist Henry Box of Plymouth, England says, for colds, influenza, fevers, inflammation of the brain, pneumonia, stomach, bowels, or any part, this is a certain cure. He says, I have never known it to fail, even when given up and at the point of death. It will not only save at the 11th hour, but at the last minute of that hour. Besides, it is so safe and harmless that you cannot use it amiss. He's talking about elderberry. Then he talks about, I'm giving the infusion here, how he used it. 2 ounces of elder flowers, 2 ounces of peppermint leaves crushed, 1 1/2 pints of boiling distilled water. Now, you typically never want to boil herbs. You boil the water, but if you boil herbs unless it's a bark, you will destroy the properties of that herb. So you never put the herbs in there and just boil it. You boil the water first, unless it's like a bark. You can boil those herbs that's like the bark. If you're using a tree bark, you can boil that, but never the leaves. He goes on to say, pour boiling water over herbs, so after you bring it to a boil, then you can place the water on it once you remove it from the boil. And allow it to steep, not boil, in a hot place 20 minutes. Strain and sweeten with honey, then drink the whole amount of tea as hot as possible while closely covered in bed. Cover a hot water bottle with the cloth or towel dipped in apple cider vinegar and place on your feet. In a few minutes, there will be copious perspiration, and the pulse will slow down, and the patient will sleep peacefully for hours. Boswellia, frankincense. Who's familiar with boswellia? It's one of the best herbs for pain and inflammation. Remember, if the herb is good for inflammation, it's good for pain. Boswellia, also known as Indian frankincense, is a herbal extract taken from the Boswellia serratus tree. Resin made from Boswellia extract has been used for centuries in Asian and African folk medicine. It's used to treat chronic inflammatory conditions as well as a number of other health conditions. In May of 2013, Natural Medicine's comprehensive database indicated that Boswellia extract can reduce pain and improve mobility in people with osteoarthritis in joints. Research shows that it might decrease joint pain anywhere from 32 to 65% in those with osteoarthritis. Now, again, remember, whenever we're talking about these herbs, you have to remove or stop doing the things that brought on the problems in the first place. Let me give you an example. One of the things, if you have osteoarthritis, that's going to help eat away your cartilage because it's acid, if you're doing it, is drinking coffee, drinking tea. I'm not talking about herbal tea, but regular tea. Because coffee is so acid, over time, it's going to deplete your adrenal glands, and it's acid in the body. It's going to cause weakness also in your joints. It's going to contribute to eating away the cartilage. Why? Because it's acid in the body. The body needs to be a little more alkaline than acid. So if you keep the body in an acid state, it's going to contribute to your bones degenerating, and then it's going to contribute to you having osteoarthritis. So again, you always want to remove the things that are hurting you, and you bring in the good things. This is again Michigan Medicine, University of Michigan. Boswellia has anti-inflammatory properties that have been compared to those of NSAIDs, or non-steroidal anti-inflammatory drugs. So again, they're saying, now this is Michigan University, they're saying Boswellia has anti-inflammatory properties that has been compared to non-steroidal anti-inflammatory drugs, NSAIDs. So they're putting it, saying this herb is really good. It says, used by many for inflammatory conditions. Clinical trials have found that Boswellia is more effective than a placebo for relieving pain and swelling and preventing loss of function in people with osteoarthritis. Boswellia has also been found to be as effective as the anti-inflammatory drug Bextra. Imagine that. That's coming from the University of Michigan. In addition, while the improvements occurred more slowly in the Boswellia group than in the Bextra group, they persisted for a longer period of time after treatment was discontinued. So again, the same thing with the aspirin, with the white willow bark. It took a little longer for the pain to go away with the herb, but guess what? When you stop, the results lasted longer than with the drug. And you don't have to worry about the problems from the side effects. One clinical trial found that a combination of Boswellia, ashwagandha, turmeric, and zinc effectively eliminated pain. And also, unlike the NSAIDs, long-term use of Boswellia does not lead to irritation or ulceration of the stomach. That's one of the other things that happens with some of these NSAIDs. You end up starting with one ailment, and then you end up now with the ailment not being cured, and now you have an ulcerated stomach. So now they got to give you something else for the ulceration of the stomach, and the next thing you know, now that affects your kidney. And then you give you something for that, and then now your liver is affected. So again, when the Creator gave us herbs and natural medicine as a whole, it's kind of like grace. He gives it, and there are no side effects. Amen? And basically, they found for osteoarthritis, when they took that combination of turmeric, Boswellia, zinc, they took 1,000 milligram daily Boswellia extracts. Memorial Sloan Kettering Cancer Center. It's funny when you read, they were admitting grudgingly that this stuff has benefits, but you could tell when you read the study how they were writing it. They were like, man, we hate to admit this, but we have to do it. And this is what they said at their website. They said, results from a clinical trial showed that Boswellia may reduce symptoms of bronchial asthma, but more studies are needed to draw a conclusion. Always more studies, perpetual studies. They also said, studies done in animals suggest that Boswellia can reduce inflammation, and clinical trials support this use in humans. Again, that's from Memorial Sloan Kettering Cancer Center. Studies in laboratory animals and from clinical trials show that this herb can reduce certain inflammatory conditions. Lab studies have shown that compounds in Boswellia have anti-cancer properties. Now this is the Cancer Center admitting that a herb has anti-cancer properties. Pretty impressive if you kind of know how natural medicine is seen in some of these circles. is seen in some of these circles as quackery. Finally, our last one we'll deal with is milk thistle. Anyone familiar with milk thistle? Great, great herb to help detoxify your liver. Your liver has probably, they think it has anywhere from between 500 to 5,000 actions directly and indirectly in your body. And it's a very, very crucial organ. Milk thistle is used as a natural remedy for liver problems. These liver problems include psoriasis, jaundice, hepatitis, and gallbladder disorders. One 2006 study conducted by the Department of Pharmacology at the Institute of Medicinal Plants found that when diabetic patients were given silymarin extract, they feel to be the main constituent in this herb, milk thistle, to benefit the body, the liver. They says when they give this over a 4-month period, their fasting blood glucose and insulin levels improve significantly compared to patients receiving a placebo. The reason that is, even though it's a liver herb, your liver plays a role in your blood sugar. Did you know that? It plays a role in your blood sugar. It plays a role in your hormones as well. So by giving it an herb that benefits the liver overall, it's found to help people who are dealing with blood sugar issues and diabetic issues. Now, did you know when I look in here that the studies tell us that the evidence shows that people start off being insulin resistant, which is the first stage when you started going toward diabetes. And basically, you go from being insulin resistant to being pre-diabetic. Now, probably the studies show that, and when we look in this room, 1 of every 2 people, so that means it'll be half of the people in here, if they're not full-blown diabetics, are at the point of being pre-diabetic. That's what the studies show. Now, if you eat healthier here than outside, the numbers will be a little bit different. But in general, when you look in here, you will find that 1 of every 2 people is already about pre-diabetic because of the way that we eat in the US of A. So think about it. And so think about something like milk thistle. Again, you got to remove the negative. You got to stop eating bad things, start exercising, following those laws of health. And then also enhance the capacity of the body to heal itself by bringing in things like milk thistle. Again, now, actually, if you're dealing with something like diabetes is actually one of the easier things to reverse if you do what you're supposed to, and if you're on a good program. In 2007, after reviewing numerous studies involving milk thistle therapeutic treatments, researchers at the University of Minnesota found that there is strong preclinical evidence for silymarins, basically liver and the whole liver and gallbladder area. They found that it has evidence for being very beneficial in cases of anti-carcinogenic effects, including inhibition of cancer cell growth in human prostate, skin, breast, and cervical cells. Now, I'm going to give, I don't know if I made enough copies, because this you're not going to be able to, I'm glad I put the other ones all in white, but on here, I basically broke down to kind of show what part of the body that certain herbs have the most benefit for. And let me see here. Is it print on this thing? Yeah. You can't say this. The other ones I have are on white, so you'll be able to see it clearer. Here I have for the hair, right? I have alfalfa, ginkgo, horsetail, oak straw, stinging nettle, and sage. Here I have, again, for the skin, alfalfa, burdock root, marigold, chamomile, dandelion, horsetail, raspberry leaf. And I have handouts. I'm going to give you handouts with this on it. Again, you can see this clearer. Here you can see for the skeletal system, structural issues. Again, you have alfalfa, boneset, horsetail, rosehip, stinging nettle, and yucca. For your joints, alfalfa, devil's claw, garlic, horsetail, stinging nettle, and yucca. Again, for the skeletal system. Here, for the muscle, this is wild yam here. You might not know about that name, but that's wild yam. Horsetail, rosehip, stinging nettle. Again, there are others, but these are the ones that we know, there are just too many to cover every herb that can be beneficial. Again, for the cardiovascular system, circulation, angelica, bitter orange, butcher's broom, cayenne, hawthorn, horse chestnut, lecithin, stinging nettle, white oak. For the lymph nodes, bitter orange, burdock, dandelion, lobia, red clover. Again, circulation, you can see the ones that go to specific parts of the body that's shown to benefit certain parts of the body. Again, the endocrine system, the endocrine and nervous systems, you can see for the thymus gland, the herbs, for the pancreas, for the brain, the central nervous system, the adrenal glands. You can see the herbs that are shown should be made up a part of these particular areas for when you're dealing with these areas in the body, if you're trying to work on them to make them better. For the urinary tract, again, you see butcher's broom, celery seed, corn silk, cranberry. This is very, very good for if you want a natural diuretic, corn silk. Horsetail, high in calcium, juniper, that's also good for diabetes, parsley, uvauracil. Again, for the kidneys, astragalus, corn silk again, dandelion root, oak straw, parsley, cyprium for the urinary tract. For the digestive tract and respiratory tract, here you see for the liver, black radish, burdock, dandelion, milk thistle, red clover. And for the gallbladder, you see these here. For the lungs, this elderberry that we talked about for inflammation there. For the stomach, for the intestines. For the ears, eyes, and mouth, butcher's broom, garlic, ginkgo, you can see there. Now, what I did, I printed, I think there's more people here than I anticipated. And so I made, how many copies is this? About 45 copies. But we did bring, just in case, if we have a copy machine where you need to make more copies, I brought an extra copy to copy them from. But it's like it's 4 pages. But so everything that I just put up there, pretty much, that's if you want to make more copies for people who might want. But these are the ones that are available to give out. It's like 45.
You should say 1 per family.
1 per family will work too. If you're interested in having that, you can, yeah. As they're doing that, as you can see here, for the eyes you have, again, normally if I was making a formula or buying a formula, if I was making a formula, and I would have, for my eyes, I'm going to look at, okay, it's best not to just have one herb, but to have say, bilberry and eyebright and ginkgo and shepherd's purse and yarrow, have all of them in that combination. And these are not the only ones, there are more, but this is just some examples that you can use, that you can look at as a reference to say, okay, what herbs are good if I want to help benefit my brain or my hair or my skin or my this or whatever. This is a starting point that you can use to look at. Ginkgo is a very popular herb used for memory. But even like I said before, even if I was using ginkgo in a formula, I would always add cayenne. If I was going to make a formula, I would always add cayenne with all herbs except for nervines. So that ginkgo, like I said, ginkgo has been shown in studies to basically dilate the vessels to help blood get to the brain. But like I said, when you combine cayenne with it, it's going to do it even quicker and more efficiently to get it through the brain. So again, golden seal is a very powerful natural antibiotic. You familiar with golden seal? Very, very powerful. But when you're taking golden seal, you should take it like maybe 7 days and then stop, lay 7 days off, and another 7 days. It is a powerful natural antibiotic. Of course, garlic. I call garlic God's antibiotic. It's actually, when you compare garlic to antibiotics, garlic works like a broad spectrum antibiotic. It kills microbes, viruses, bacteria. Garlic is one of the, we didn't talk about it today because it's a food, but it's also a herb. But it is one of the most powerful herbs/foods that you can use. Tea tree oil. Anyone familiar with tea tree oil? I'm going to tell you an issue we had. I used tea tree oil. For one time I'm going to use my wife again. We used to live up in Claremont, and we came home from church one night. We got there, because we go to church in Opopka, so we got there. By the time we got back, it was at night. And she was out in the yard, and the next thing you know, she started doing the dance. And she was in fire ants. So we got the fire ants off. I said, go in, and I said, I'm coming. So I took charcoal, powdered charcoal, because it was burning. I took powdered charcoal. I told her, put her foot over in the sink in the laundry room. She put her foot over. I took the charcoal with the water running over her legs. I just rubbed the charcoal on her legs like this. The fire stopped. The burning stopped. But what replaced the fire was itching. So then I took the tea tree oil and sprayed it on her legs and rubbed it in. And it was like it never, about 5 minutes, it was like it never even happened. So there we took, again, the charcoal. So that's when I say, when we use these things, when I talk to you about them, I'm talking from knowing that they actually work, from experience. So again, we use the charcoal because, remember I said before that any type of insect bite, you have charcoal on hand. So when the fire ants begin to bite her, after they, again, just rubbed it on her. Then, after the fire went away, we start using the itching cane. We sprayed the tea tree oil on her. And again, sage, myrrh, golden seal, again, ginkgo biloba, again, butcher's broom for the ears, etc. We're open to, I guess, maybe 15 minutes of questions. Now, I'll tell you straight up, I don't claim to know every answer to every question. The way you stay on top of something like this is to always keep learning. So I'm always learning, always keep learning. I see. I forgot we have 2 mics here.
Yes. For the tea tree oil you just referenced, did you use it in a concentrated form, or how did you use it?
Yes, just straight out of the bottle. I just sprayed it. I didn't dilute it at all. I just sprayed it directly on her legs and just rubbed it.
Oh, okay, thanks.
Fibromyalgia, what do you do about fibromyalgia?
Fibromyalgia, the question is, what do you do about fibromyalgia? Fibromyalgia is actually fibromyalgia is actually the symptom of a severe adrenal fatigue. And so, in order to deal with fibromyalgia, you actually have to deal with the underlying adrenal fatigue or adrenal exhaustion, and which is if the person is up and about, you have a lot better, it's easier. But that's something that normally takes probably about 3 months to deal with on a good protocol. But normally fibromyalgia, this is why the doctors say, well, we really don't know. They really can't tell you the cause because they're not really, it's associated with adrenal fatigue or adrenal exhaustion, and they're just now beginning to accept adrenal fatigue as a legitimate abnormality. But that's really what you have to look at. For fibromyalgia, you have to look at adrenal fatigue, and once you deal with the underlying adrenal fatigue, typically the symptom of fibromyalgia will go away. And dealing with adrenal fatigue is, because it involves the endocrine system, the adrenals are the shock absorbers of our body, so they help us deal with stress. And basically, though, we have what we call buffering vitamins. That's why whenever you take B-complex vitamins, it feeds your adrenals. But when we stress, it can burn up those B-complex vitamins, and then the backup system of the body will kick in. And then it involves the nervous system, and before you know it, you have a lot of issues. So basically, to make a long story short, you have to deal with that. You have to deal with that before you can deal with the fibromyalgia.
I cured my fibromyalgia with a magnetic bed pad.
Oh, did you?
Magnetico in 2 weeks, and all the pain left, and we've never had a problem.
Interesting.
Magnetico, not the Japanese ones. You wanted Magnetico. They have all the magnets going the same direction. They were in Canada, and now they're in Las Vegas.
Okay, thank you. That's was it?
Hello. Yes, I have a question. Now, and talking about herbs, do herbs, here's my question. Let's say, you're using herbs for heart issues. You combine that with dietary issues, moving away from like a whole food plant-based diet, and combined with the herbs, or you just use the herbs?
Yes. Combine it always with if you have heart issues, I would highly recommend that you start getting to a plant-based diet and combine that with the herbs, like the heart herbs, like hawthorn berry and cayenne. Those are going to help because normally what ends up causing heart disease is primarily three things: the diet, not exercising, being stressed out, but mainly a big role of it is having to do with your diet and some of the other issues, stress too. But yes, definitely, as I was saying earlier, that we can't just say, okay, I'm going to take some herbs, and you have to do more than that. You have to take the herbs, but that needs to complement what we talked about as the 8 laws of health. It needs to complement trusting God. It needs to complement exercise and eating right. It needs to complement all of those things.
Good. Just two things. The second one then is, like, I was thinking that you could use herbs just like you would a drug. In other words, you just use you take the herbs and then you think it's all going to take care of it. So what you're saying is, and you really answered the question, is by combining it with the 8 laws of health, 8 natural doctors. Could you go over them quickly, because some folks here may not have heard what those are?
Yes, the eight laws of health, and they can actually all be traced back to Genesis. You can find all of them in Genesis. And basically, there's trust in the Creator, sunshine, exercise, water, air, rest, diet, and self-control or temperance. Now, those are the broad laws, and under each of those, like for instance, under water, you have to drink the right amount of water. Hydrotherapy, if you get sick, taking showers, hot and cold showers, all of those things fall under the health law of water. But drinking the amount of water, taking showers, help with the circulation. So each of those laws of health, like under diet, under the health law of diet, it will fall encouraging trying to get to the point where you're on a plant-based diet. Not eating between meals, not mixing a whole bunch of different foods together at the same meal, not mixing fruit and vegetables, not drinking when you eat. All of those fall under diet. So again, not lying down sooner than 3 hours after you eat. Now, you know how we eat and we get really like, oh man, I'm sleepy, right? And so we go and we lie down. But the problem, you have a vagus nerve that runs from your brain all the way down to your gastrointestinal tract. So when you eat, and that vagus nerve plays a large role in digesting your food. So say you're up and you get sleepy and you lie down, the organs are going to press up against that nerve, and it's going to alter the ability to help digest the food, and then the food is going to rot. And then it's going to become toxic. And then if you do that over and over and over, 3 meals a day, how many times you do it, before long, your body's going to be toxic inside, and you're going to start having problems. So again, that also falls under diet. So when we look at diet, you have those laws of health, but underneath each one, you have to eat right, not eat too late, not mix wrong food, not mix fruits and vegetables at the same meal, not eating sooner than 5 hours in between your meals. Don't be on the 1 meal a day plan. You know what the 1 meal a day plan is, right? All day long. People just eat straight through the day. That will wear out the gas. Now you will hear, like in a lot of the dietitians, they will say, oh, you need to eat 10, 11 small meals every day. 6, 7, yeah. The problem with that is that you're going to wear out your pancreas. You're going to wear out your pancreas, and then you're going to have diabetes. And so because every time you do that, the pancreas has to keep churning out digestive organ enzymes, et cetera, et cetera, et cetera. So,
Yeah, I don't know. This one? I just wondered if you could name a couple, because it's a lot of information, and try to remember. Okay. Anyway, if you could list a couple books, that would be good, that have some general information about to continue.
A couple of good books. Let me think. Dr. Christopher's book, what's the name of that book? I can't think of the name. If you just if you go online and look up Dr. Christopher, Dr. Christopher Indy, and you'll probably have, he has one of the best books on herbology. There's another one called Back to Eden.
Back to Eden?
Back to Eden. Yeah, Jethro Kloss.
And then because you had mentioned that when your first slide was about the charcoal remedies.
Right.
The charcoalremedies.com.
Right. That's a great book to show you use a lot of different ways of using charcoal, because many people have heard of. Yeah, more specific in details, because a lot of times some people here may be familiar with how to use charcoal, but there are a lot of ways that you probably hadn't thought of and how to use it. And some ways you can use it for certain illnesses or ailments that it can work for that, or even ways to use it differently. Well, there's even some ways that I read in there that I thought, wow, I never thought of using it like that. But there are ways that can be very beneficial.
Ask if anyone didn't get one of these.
Anyone didn't get that one of the handouts?
If you can repeat the question sometimes.
Okay. Okay.
Yeah, Dr. Henry, what about beta-glucan?
I'm sorry?
Beta-glucan?
Mm-hmm.
Can you comment on that?
It's good.
Okay.
Can you elaborate more on the milk thistle?
Yes, milk thistle. Milk thistle is for people who have even non-alcoholic liver disease, or even if they have alcoholic damage. If they stop drinking and be on, like, maybe if they were on like a milk thistle, which was standardized maybe between 400 and 700 milligrams, and they were taking it maybe 3 times a day, the milk thistle has shown the ability to bring back liver disease from either non-alcoholic liver disease or liver disease caused by alcohol. It's also can benefit, as I pointed out there, some people as a side or a good side effect, they got benefits who were people who were suffering from diabetes.
I was just going to ask you if it's good for diabetes.
Yep.
You take it like a supplement?
You take it like a supplement, yes. And the question was, she wanted more information about milk thistle, the herb milk thistle. You do take it like a supplement. Yeah. And sometimes when you take milk thistle, if you have sometimes you may feel a little biting, not really biting, but you can feel it sometimes when you take it.
How much milligrams?
Depending on what you're trying to do, but basically, I would say probably 450 to 500. How much milligrams? Maybe 500 a day. You start off, 500 milligrams, 450 to 500 milligrams, and then for basically tonic. But if you have liver issues, of course, you need more than that. But it's hard to say because everybody is different, and some people may be working on something different. Where some people may just want it for maintenance purposes. Other people may have something that's really wrong. And so basically you have to say, okay, how's their overall diet? How they follow these other laws of health? Are they exercising? Are they not exercising? Because say if you're exercising, it's going to benefit the health of the liver. So you might not need to take as much, So a lot of things come into play.
I have 2 questions. One, how much water would you suggest that you drink in a day?
Normally it's based on your weight.
Huh?
It's normally based on your weight.
Okay.
For most people, it's going to be 8 to 10 glasses, but it's really based on your weight. And I forget the formula right now. Anyone know the formula for the half your body weight in ounces? Okay.
All right. That's one question.
Just about failure. They can't drink too much.
Right.
You have a list of herbs here for bladder infection. And do you take these as a combination?
You said, well, they're for bladder, to help for the tonic, but generally speaking, you're going to get a better result when you mix 2 or 3 herbs that work together synergistically. So yes, then you get when you take one.
Along with Dimanos.
I'm sorry, I didn't hear the last part.
I say, would you suggest also Dimanos? Dimanos is an herb.
E-M-A-N-O.
Oh. Yeah.
Dimanos.
Okay. Yeah, you can any combination is fine, but here's what you want to look at is that you're going to always get a better result, right? Say if you're just taking one herb, you're going to almost always get a better result when you take 2 or 3 or more that's together, but they need to work synergistically together.
Okay.
Are you familiar with Dr. Schultz, Richard Schultz?
Yes.
Okay. The reason why I ask is because you had referred earlier to the 2 men that had hurt themselves and lost skin and everything. He was one of those, I do believe.
Yeah, he did. Same thing happened with him. And I think it happened to him when he was a grown-up.
Right.
Yeah.
Yes. Right.
Right.
But he has probably the best herbs that, you know, most of us can get.
Right.
Because they're very potent. So I recommend
Dr. Schultz.
Dr. Schultz it's 1-800-HERB-DOC.
Right.
And his stuff is really
Very high quality. Right?
Yeah.
Right. Herb doc.
So if you take that milk thistle, you don't need to take your like metformin and
Well, the question was, if you take milk thistle, do you not have to take your metformin, which is for diabetes? His first, never stop your medication. Also, if you go to a knowledgeable, either a naturopath or a herbalist or even a medical doctor that teaches herbology, what he's going to know, he's going to check. He's going to know whether or not whatever herb he gives you is going to have a contraindication with the medication. So what happens is, depending on what you're on, let's say you're on milk thistle. Milk thistle probably has no contradiction, but never stop your medication on your own. Always, you know, as it comes down, you know, go back with him, because sometimes the body has become conditioned to the medication that you're taking. And sometimes if you stop it like that, it may cause other problems. I think she was next.
Yes. Can you tell me the combination and the amounts that you take for the anti-inflammatory drug that was comparable to NSAID? It was Boswellia.
Oh yeah, the one with the Boswellia. I think I have it on the. I don't think I have it off the top of my head. Can you? Yeah. But it was. Let me give you. If you give, I give you my email. If you send me an email, you can. I can give you. I can give it to you. You got it written down? Do you have it written down? Did you? They may have it written down. I didn't. But it went for the Boswellia? Oh, no. I think she was talking about the one with the ashwagandha. The ashwagandha. Okay. Yeah. Because they were actually citing a commercial product that had that in there, but I can send you that information. I give you my email.
I have a torn ligament in the Mishka. Will the comfrey help it reattach?
It'll help.
Will it restore and grow back cartilage?
It can restore and grow. I can't say specifically for your case, but I can say because of legal reasons that
You've seen it happen.
it can help. Yeah.
What about CBD oil? Anything?
CBD oil?
Without the punch.
Without the punch. CBD oil has some benefits, but it also has some potential issues as well. I know without the THC, in very, very small amounts, right, but, you know, okay. I have her. Was she early on? But with the CBD oil, that can get into a big discussion, but I just say, right. But since someone asked, I know when I was speaking, someone had a question about charcoal. I think it was, you might not remember it.
I have two different things, but I'd like to know where you're located.
Her question was, she said she had two different things. She'd like to know, where am I located and how much do I cost? I'm over in Orlando, over by Millennium Mall, and the cost is based upon what needs to be done. No. And you know, and she asked, was it covered by insurance? The problem is this, is that the pharmaceutical companies have fought against natural medicine. And as a result, yeah, you know, they try to put the chiropractors out of business and try to put the natural medicine. And so basically, so this is why insurance, except on the West Coast. On the West Coast, a lot of insurance is starting to cover natural medicine. But here on the East Coast, I think her and then you.
I have a neurological disorder called I'm sorry. I have a neurological disorder called truncal ataxia. Is there anything that can improve my condition?
Possibly. Possibly. Yeah. Depend. A lot of times that it goes, how long has the condition been present? A lot of times that has a lot to do with it too.
Just during this year.
Just during this year?
Since February.
A lot of times, the sooner you catch it, the more likelihood that you can have something could be done that benefits. But it's hard for me to just say yes or no, but possibly. Possibly.
My question goes along with something they asked earlier about where are you and where are you located and such. It's difficult to find people who have knowledge in the herbal area. How do you seek out someone in your area that has that kind of knowledge and is willing to have a laboratory blood test done, look at the results and say, these are the issues that I see and plus what you're telling me and this is how we can treat them? How do you seek out someone?
Probably one of the best ways is like when they have things like this, when the church brings in different practitioners or people who are speaking, or sometimes you can go online, but the problem with Florida has been one of the most, the worst states. And so a lot of natural practitioners say, you know, I don't, you know, even Thomas Jackson, New York, he's been here. He even used to have a clinic here, but it was so rough that he shut it down and moved out, went to Tennessee. Because they try, a lot of natural practitioners say, you know what, it's not worth it. When we can go up to Georgia or go out to Colorado or go somewhere and it's not worth it.
Is it under your name or do you have a clinic name or school name?
Well, it's my office. I have an office. And so basically it's a ministry / and it's a practice. The ministry side is Phase 3 Ministries. The practice side is Phase 3 Wellness. And again, like I said earlier, whenever you have natural practitioner, there has to be the spiritual side. And so normally when I'm dealing with people, and to be honest, I've gotten a lot away from it as well. I decreased taking cases probably in the last couple of years because it's just getting to the state of Florida. They're just getting there. Yeah. And so you can go I got a website, phase3ministries.com. Phase 3 Ministries. PHASE 3 Ministries. I think she was next. Yes. Her question is there a recipe for reversing diabetes?
Yes, there is.
Yes, there is.
Coming in February, we'll be having a seminar here called Diabetes Undone. We did it once already this year. It was a big success, and we'll be doing it again.
There you go. Thyroid? Yeah, that's thyroid as well. It's going to go, it's a little bit more involved than diabetes, and depending on what's there and what's going on. But there's things that help the thyroid too. And normally we see a lot of women with thyroid issues for some reason, more than men. But I think Minstries. I think she was next. I think we got room for what time? 1 or 2 more we have time for? I don't know. They told me I had so much time. Okay. Now Lorraine. Now these were two of the students in the classes, and again they were the classes were the first one were 8 weeks. The second one was 6 or 8 weeks. It's literally like when you go into the videos, it's probably like 50 hours worth of video covering all of the classes. So yeah, it is.
Were you talking about Dr. Reedland?
Dr. Reedland. Yeah, in the third class we did, Dr. Reedland is a physical therapist. So he came in and agreed to teach the third class and to talk about exercise and the body mechanics and whatnot. So that's pretty much when we were doing the medical missionary classes.
Yeah, my question is, I know that cancer is, stress related, and also because people are nutrient deficient. Okay, so I've heard and I listened to something that they're saying now that it's also caused by a fungus. Could you tell us something about that?
She said that cancer, one of the things that can contribute to cause cancer is a fungus. And it's interesting, viruses have been associated with being able to cause cancer. Mucus. And the reason mucus is because whenever there's trash in the body, mucus, then it attracts bacteria, viruses. It's kind of like a garbage can. Say if you have a garbage can, you leave old food, it rots, flies and whatnot comes into the garbage can, right? But if you clean that garbage can out with whatever cleansers, the flies and whatnot, they don't come. The same thing with inside the body. If the body is full of mucus and waste, what happens, it creates an internal environment where these viruses and parasites, and by the way, we didn't deal with the herbs on parasites, but most of you in here, most of us in here, we probably have bugs inside. And some of these parasites look like spiders, some look like worms, yeah, some look like scorpions, snakes.
Some of the main ones 6 feet long.
Yeah, and longer. Yeah.
So what would you do for fungus, for somebody that has cancer? What's the best thing to try and to help him kill the fungus?
Well, the question was, what would you do with a person if you're treating them with cancer and one of the elements is fungus? Well, as you know, cancer is a very complex disease, but basically the basis is with cancer, with most diseases, is the first step is you got to clean the body out. It's the first step. And once you clean the body out, which would include dealing with funguses, but you would use different herbs, different supplements, different herbs that's known to be antifungal, and like garlic, for instance, are known to be antifungal. And then once you clean the body out, and then the next step is to refuel the body with nutrients. Because remember, the body is depleted in cancer. So once you cleanse it out, clean the impurities, then you refuel it with nutrients. And of course, the person's on the laws of health. And over time, with the blessing of the Creator, then if it's His will, But there's been a lot of cancer cases that's been reversed, even 4th stage cancer.